and to be able to provide some reflection on this. I was just saying to Aisling, it's so amazing for all of you that have been involved in this project, because I think in one's career, you really only have the opportunity, a few times to really be able to bring something to fruition and to know that you've changed the lives of children and families. And the evaluation report was so robust and so positive that I was just taken away with it, Caroline, as you were going through it, and just how amazing that is. And then, perhaps just coming from a country where there's very few universal services, we have almost none really. And I was just like listening to this panel and thinking, just how important it is to have access. We don't have universal home visiting with public health nurses. And, I just remember my own experience almost 14 years ago, having my daughter and feeling incredibly confused and having no one to talk to. So this was just so compelling and amazing that a country can do this. So it was great. So with that in mind, I am going, don't worry, this is only one kind of slide just on implementation science. Then we're going to go through a few things. You've been hearing this term implementation science, I think, all morning. And so hopefully we'll bring that, continue to bring that to life with these closing comments. But I want to kind of draw a connection between implementation research and implementation practice and what's so unique about what was done in the Nurture program here in Ireland. So implementation research is how we understand the approaches that work best to translate research to the real world. So everyone was kind of saying, we want to be able to use evidence-based approaches to improve outcomes for young children and their families. And so what implementation research does is it gives us strategies to be able to move those evidence-based approaches into the real world. But then there's something else, and it's called implementation practice, which is how we test and apply those strategies in different contexts. So we know that some of those strategies are implementation teams, using data and evidence to inform decision-making, engaging stakeholders, co-production, and usability testing. And so if those are strategies from implementation research that have garnered some level of evidence that they're worthwhile to use when you want to implement something, the idea then is, what would they look like in Nurture? So it's interesting, we know that implementation teams matter, but what would they look like in such a wide-scale initiative? So that required implementation practice expertise and to kind of test out different structures. So that's why this is such a unique application of implementation science here countrywide, is because you took evidence from implementation research and you applied it and kept testing it out till you could yield those positive benefits. So what I wanted to do in these kind of closing reflections today is to talk about three things that I think really stood out just in my journey with Nurture and being able to kind of come in, as Anne said, a couple times a year and meet with folks, but also in reading the reports and in listening again to Caroline earlier and the evaluation findings. I think these are maybe some of the correct three things to choose in terms of what really supported implementation of Nurture, but really more importantly, why you need to keep doing these three things. Because while this is a celebration today, I think it's a celebration with an eye towards sustainment and really wanting to be able to yield population level change and improved outcomes and equitable outcomes so that we actually see improved outcomes for all children and families in Ireland. And so in order to do that, I think it's going to be really important to look at what you did right and then to think about how you will continue that moving forward. We're going to start with implementation teams because actually the dismantling of teams is one of the first things that happen when you start to not attend as much to an initiative. And so I want to talk about why it's going to be so critical to keep your architecture, those teams in place. They may look a little different. They may be repurposed. It may not be all the same people. They may meet with less frequency. It's hard to say exactly what that will look like. But there is quite a bit of evidence that when teams are dismantled, that we actually start to lose the benefits of the initial implementation. So we're going to talk about celebrating what you've done and how it is we can continue to think about teams as a key to your sustainability for nurture. So we know that successful implementation is a collaborative act requiring more than the efforts of a charismatic leader. This is actually new information. It's, in the last 10 to 15 years, we've understood from implementation research that while traditional leadership is important in implementation efforts, relying solely on top-down approaches has had limited benefit and almost no sustainability. So instead, the literature tells us to move to stakeholder-centered leadership. And there's growing evidence that implementation teams is a really effective way to ensure that we have stakeholder leadership that will then lead to effective implementation and greater sustainability. So here we're talking about teamwork as really the critical nature of that stakeholder leadership, and that is because implementation teams include multiple actors and perspectives in communication, problem solving, and data use. So if you think of it, one of the reasons we've kind of moved away from that solo hero model of leadership and implementation is because when we are looking to implement in complicated and complex systems, very rarely can singular perspectives troubleshoot challenges well. So it's the idea that you want to bring together multiple perspectives to be able to solve those complicated challenges that arise in complicated contexts. So with this in mind, has been talked about throughout the morning, Nurture carried out a teaming structure that was designed to facilitate those key activities of implementation and to improve the program. And it's amazing how that was touched upon, I think, in so many of the interviews that were conducted for the evaluation. So the diversity of the professionals working together was considered by stakeholders in Nurture to be a significant strength of the process. So I want to talk about the competencies that are really critical and why, if you bring together different members on an implementation team, all 4 of these competencies can be realized. Teams have to have knowledge. So they have to understand what young children and families need and why they need it. So essentially they have to have content expertise. Then you need members on a team that have the ability to develop infrastructure. So these are team members that understand what it takes to meet those needs of children and families. So that means team members, for example, that understand how to build a workforce. So what does training and supervision and coaching look like for public health nurses and other practitioners serving young children and families? You have to have team members that understand what data are needed to answer what questions and how data can be used to drive both decision-making and improvement. And then finally, you need team members that understand the system's context and are quite capable of integrating and leveraging different policies and programs and funding sources to be able to produce the work streams that are present in Nurture. So this is a really complex set of competencies. Again, you need people that understand what is needed. You need people that understand what it takes to get those practices in place. You need people that understand data use and improvement and where to get that data from. And then you need people that really understand the system's context. So as you think about moving forward with Nurture and those teaming structures, those 4 competencies will continue to be important to sustain Nurture. The other thing that will be important is to use effective team meeting processes. So as you, again, kind of think about the future, some of the things that really help those implementation teams thrive were consistent meeting times, agendas, and protocols. You had, protocols that supported that bidirectional communication and co-production that was talked about a lot. You have defined improvement processes. So how it is that you're using usability testing to continue to improve those products that were critical for Nurture. And then this last one, there's quite a bit of evidence around this, that team members only keep coming back to teams when they have the ability to personally learn and grow. So team members, the first meeting that will come off the books for the day are meetings that they don't feel like they're getting anything out of. So that seems like a duh in life, but the key is that you want to keep setting up your teams so that members have an opportunity to contribute, but more importantly, have an opportunity to learn and grow by being on those teams. We also know that there are certain contextual factors that lead to sustainability. So those top 4 on the slide are factors that have been identified through systematic reviews that are critical context factors that lead to sustainability. So the first is a learning culture, both at local and national levels. The next is absorptive capacity. So absorptive capacity means the capacity of organizations and systems to both identify and use evidence. The availability of data to inform decision making. And strategies to address power dynamics and motivation at organization and systems levels. I bring these 4 contextual factors up for discussion because I think that implementation teams are critical in creating those factors. You can see along the bottom some of that data that Caroline was presenting earlier, that we know that the vast majority of stakeholders agreed that the collaborative approach was really critical and that it had improved both within HSC and between HSC and its allied agencies. So if we know that the teams are working and we know that teams can really lead to those contextual factors being in place, I think it's great motivation to keep those teams going. And we know that nurture will be integrated within the National Healthy Childhood Program. So it's thinking, how will those teams be integrated as well? So what will that look like moving forward? The next is celebrating the effective communication that's been established with nurture and then thinking about how we sustain that. So it's really interesting in implementation science that sustainability has been increasingly conceptualized not as an end game, but as a dynamic construct where we're continuing to adapt in response to new evidence, new policies, and other influences. We can all probably think in our mind other influences about 1,000 things right now, what those things can be. But it's really interesting if you think about, for those of you familiar with implementation science, most implementation science frameworks really show the stages of implementation. And so basically they talk about how we kind of explore and then we plan and then we implement, and then we sustain. And it was this idea, and I think it's because sustainability and implementation science was historically equated with fidelity, that we'd keep doing the same thing the same way over and over again so that we could keep getting the same results. But more and more the field of implementation science is viewing this idea of continuous adaptation as what's really critical for sustainability and for continuing to get improved outcomes. So there's quite a bit written now on dynamic sustainability, which is really based on continued learning, problem solving, and ongoing adaptation. And it was talked about earlier for practitioners. It was an unbelievable statistic. I think 91% of practitioners reported that they now understood research evidence and how that could be integrated into their practice. Well, we know over the next 5 to 10 years, new evidence will be generated. And so it is thinking about, our adaptive nature and how it is that we're going to continue to respond to that. So both our ability to collaborate and to communicate is particularly important in our ability to respond effectively to changes in policy, changes in political leadership, changes in funding, and changes in our population. So we continue to have immigration and other issues happening. It's really important for us to be able to be responsive to the needs of our population, knowing that our populations may change over the years to come. So really, the development of the Assistant Director Public Health Nurse Network and the recruitment of the health program development officers was considered a really key aspect of improving communication. And again, it's really critical to see how many stakeholders in interviews for the evaluation reported increased levels and improved communication, and that noted that it was a positive change. So if we think of communication as particularly important to responding to changes in our environment, and we believe that our ability to respond to those changes in our environment is a key to sustainability, and I think it leads to the conclusion that our ability to continue that effective communication will be critical to the sustainment of nurture and everything that's already been kind of celebrated here today. Kind of going back to that first point around implementation teams provide the architecture for communication. That's what helps us ensure that we have feedback loops between practice and policy so that what's happening on the ground is informing our policymakers, and that good policy based on evidence is informing our practice. And without those two things happening in alignment and simultaneously, we really, again, will struggle to be able to sustain the good work done. And so it's just thinking about how do we continue those effective policy practice feedback loops. I've already been told this structure is going to be changing, so I understand that with this slide, but it's just thinking about how it is that we continue to ensure that information moves up a system and, again, back down a system effectively. And then finally, I want to celebrate the trusting relationships that have been built with nurture and talk about why trust is so critical to both implementation and sustainability. So we think of trust as the cornerstone for effective partnerships. It engenders faith that partners can rely on each other to come through on agreements and to even anticipate one another's needs and interests. Implementation relies on learning, taking risks and failures, and at the center of all of that is vulnerability and trust. Everyone talks about that implementation takes time. What takes time is building trusting relationships, and trusting relationships are the foundation to implementation science and probably the least researched aspect of implementation. So there is some studies that have come out over the last decade that have shown that trust is a critical aspect of successful implementation, but we know much less about how we engender trust. So I'm going to give some initial ideas around that today, but we really do, I think, need to understand more about how we can engender trust in our work, because without that, then nothing can move forward. So building trust and understanding among the partners was key in those initial phases of nurture. So there really was this value placed on honesty and critical discussions. And so in looking back over the last, 4 to 5 years, there was structured facilitation that was used. So this idea of kind of bringing in an external facilitator that would help to get people on the same footing and to really engage in those challenging conversations was a really key part of the work. So I think in the beginning, earlier today when the evaluator was talking about, things took a lot of time in the beginning, but later people said, hey, I actually didn't mind all that time because I now feel like we're kind of reaping the rewards of it. So one of the ways you can kind of measure the extent to which you're moving into these types of relationships that are really trusting and built around empathy is when you can start to see that there's less time spent by people talking about their point of view, and you start to see an equal time spent on trying to understand the points of view of others. Because at the heart of implementation is empathy. So policymakers have to understand how hard it is to be a practitioner on the ground with a large case of families to see driving around the country. Practitioners have to understand what policymakers are sometimes up against in terms of politics and funding constraints and time resources. And both policymakers and practitioners have to understand the needs of families. And I think Frances said earlier, if this isn't for families, if this doesn't work for families, then what's the point of it? That is a new idea, by the way, because while co-production and co-design efforts have been around for a while, they have been around more in traditional healthcare settings, they are not often around in maternal and child health settings and in social service settings, and in particular in the setting I do most of my work, which is child welfare. And so we continue to develop interventions that families don't want or think that they need, and then we wonder later why we don't sustain anything. So it's not really magic. I mean, part of it is truly understanding the needs of children and families, and the lengths that Nurture has gone to understand those needs is not only heartening, it's good science, and it will lead to greater sustainability. When trusting relationships exist, information is more readily exchanged, and multiple stakeholders can exert influence on the implementation process. And if we want equitable implementation with equitable outcomes for all children and families, then we absolutely must value the input, the influence of multiple stakeholders. So a parent's perspective is just as important as an academic's perspective, is just as important as a policymaker's perspective. And until we really, really value that all of those stakeholders' perspectives are of equal merit, it is really hard to imagine a world where we can implement and sustain well and get to those impacts. Creating those cross-agency working relationships takes time and commitment. In reading through some of the final evaluation materials, it is amazing how the Nurture program did a bunch of things to really allow for those working relationships to happen and for that trust to be built. So significant time was let and allowed for those relationships to happen. There was secondment of HSE staff to the Center for Effective Services and vice versa, so that there could be a deeper understanding of each other's perspectives in the work, which is at the heart of empathy, which, as we just talked about, is a key factor for effective implementation. And there was flexibility in governance structures that allowed for specific issues to be advanced, discussed, and solved together. So as I've been noting for the last few minutes, perhaps the most important foundation for implementation is the ability for stakeholders to empathize and understand the needs of others. Implementation should occur within an environment of mutual respect. So there was some discussion earlier around how the teams created a sense of mutual accountability. So along with that mutual accountability, we want to ensure that we have mutual respect. And so down there is just some of the ways that Nurture showed respect for parents. Parent consultations, there were 4,000 parents surveyed. There were several, I think 10 focus groups conducted with parents. There was consultation with providers. And those consultation findings were shared with parents and providers in an accessible way. It's a really key aspect of implementation is we don't want to just be takers. We don't want to take information from parents. We tend to think that we're collaborating when we're gathering information from surveys and focus groups, but true collaboration and co-creation only happens when you're sharing in those decision-making processes and you are allowing populations that are typically marginalized in decision-making to truly weigh in. So in moving forward, one of the ways you can keep parents' voice at the center of this is through your continuous improvement efforts. Parents can actually give an incredibly important lens on data. Data tell a story, so if we want to improve certain health numbers, we don't just need researchers and policymakers looking at that data. I encourage HSE and others to bring parents in and have them help you make some sense over why data may look the way it looks. They're often left out of those processes. Finally, I wanted to talk about this concept of both intrapersonal, and interpersonal trust. So I was trying to think, what are some proxies of measures that we could show that both of these types of trust have been built with Nurture? So intrapersonal trust, it might be that I say Francis is a trusting professional, or Brita might say my public health nurse was a trusting practitioner. I trusted her. So she has some credibility to me when she comes in. So one of the ways that we can see that is that 85% of users reported the website was trustworthy and reliable. So they felt as if HSE and public health nurses and the government, that it was a trusting resource. That's intrapersonal trust. And then you need interpersonal trust, the idea that as we work together, we trust each other. We are in reciprocal relationships where we can count on each other. We believe we have a shared mission and vision. And going back to those ideas of good teams, that we can anticipate each other's needs. So the idea that we have stakeholders involved in nurture implementation, reporting real progress, not just in planning, but integration of services, I think is a good proxy for the idea that interpersonal trust was being built as well, because service integration relies heavily on professionals trusting each other and sharing information with each other. So as you move forward and think about sustaining these trusting relationships, there's a few clues in the literature in terms of how that happens. So explicit, clear communication. So we don't want to lose that second point about communication. Long-term commitment. So I think having your CEO from HSE here this morning and really talking about the long-term commitment to both parent inclusion and parent voice and prevention and all of the things that nurture is really wrapped up with, that those are goals of the country, and then making time for those frank conversations to happen. Because what we do know is that trust is built through micro interactions. It's actually not built through sweeping kind of gestures towards each other. So it's actually built through little interactions that happen frequently over a longer period of time. And that's really interesting because that's where you get the jokes and the laughter, and you ask someone how their child is doing. Those things really, really matter. And so that's, again, why solo hero models of implementation really no longer have been shown to be effective, because having, a single charismatic leader come in and kind of show sweeping, buy-in for a new initiative, that's not how trust is built. Trust is built through the folks in this room who came to all their implementation team meetings and met and shared and laughed and were frustrated together. And these are the pieces of implementation science that are often not talked about because they're part of the practice. But without implementation practice, and that practice feeding into research, there is no science of implementation. So I'm really thrilled that at home and abroad, we're seeing more and more research on the relational aspect of implementation. And I think that is really present in the room today. So I congratulate you, wish you all a very Merry Christmas and Happy Holidays. And I think there's closing comments from others, right?